everyone, and welcome to the CFES Live Chat. I'm Aubrey Brissett, the Director of Communications for College for Every Student, and I'm joined by Dr. John Fortune.
Hi, Aubrey.
He's an active trauma surgeon and surgical educator at the University of Vermont Medical Center. And welcome to the CFES Live Chat. I'm Aubrey Brissett, the Director of Communications. We'll be talking about healthcare careers and how we can encourage and support our students along their pathways. During the live presentation, you can participate by posting your questions and comments in the chat window, and Dr. Fortune will answer your questions after the chat.
Thanks, Aubrey.
Thank you.
Good afternoon. My name is John Fortune. I'm a trauma surgeon and a professor of surgery at the University of Vermont School of Medicine in Burlington, Vermont. The CFES folks have asked me to come by today to talk to you a little bit about how we can encourage our students, whether they be in elementary school, middle school, or high school, to consider, not necessarily decide upon, but consider a career in healthcare. What we're going to do first is I'm going to tell you a little bit about myself and how I got here. Then we're going to talk about healthcare careers and what the need is for the future, what some of the incentives are in terms of compensation and some of the attractions. And then I'm going to lead a discussion of what we can do in the classroom to encourage our students to consider this career pathway. So I'm a trauma surgeon. I'm board certified in general surgery and critical care. And until very recently, I was the trauma medical director for a regional trauma system that encompasses most of northeastern New York and 2/3 of Vermont. As such, we take care of about 1,200 patients every year who sustain major injuries. It used to be that the major mechanism of injury in our trauma center was motor vehicle crashes, but that's changed. Now it's falls, particularly among the elderly. Now, these patients get injured pretty badly. They have brain injuries, chest injuries, abdominal injuries, orthopedic injuries, and they require a lot of care from our trauma team. So it's not just me taking care of these patients. It's an entire team of nurses, physical therapists, occupational therapists, pharmacists, laboratory technicians, bedside technicians who provide the needed care to get these patients through the resuscitation area, that can be pretty exciting, the operating room, the critical care unit, and off to rehabilitation so that they can get back to a useful lifestyle. At our trauma center, we do a pretty good job. About 95% of our patients make it through to hospital discharge, and about 80% of them end up going home to a relatively useful previous lifestyle. Well, that's enough about my clinical experience. I can tell you what really floats my boat is my role as a surgical educator. As such, I have contact with the third-year medical students in their required third-year clerkship, where I give a lot of the introductory materials and then work side by side with them taking care of patients as they're exposed to the principles of surgical care and surgical disease. I also have contact with our fourth-year students who really are looking at specialty services and trying to decide what kind of specific career they want to enter into. I'm also the residency program director. I have been in a number of other different programs and work with the students who have graduated from medical school, have chosen surgery as a career, and now are getting extra expertise, technical education in terms of getting into their eventual career successfully. But that's enough about me. Let's talk about students and how we can encourage them to one day be a member of our healthcare team. Now I'm going to switch off to PowerPoint here, mainly because I'm going to show you some data that I'm really not smart enough to remember all the numbers. So we're going to convert right now to a couple slides in PowerPoint. So what is the attraction of a healthcare career? Well, let's talk about numbers and whether students that embark upon this career choice are going to have jobs in the future, because indeed, if we suggest they go into a field and there's no opportunities for employment, it certainly wouldn't be in their interest. Well, looking at historical data on this slide, which is actually from the Bureau of Labor Statistics out of Louisiana, but can be expanded to the national experience, you can see that over the past 20 years that the number of jobs in various sectors in America really differs in terms of its growth. On the bottom, you can see that manufacturing jobs really have contracted over this period of time. And on the top, in blue, with a solid line, you can see that medical and educational jobs have actually increased almost 80%. If you take the healthcare sector out of the education sector, about 50% of that growth is in healthcare alone. Let's look at this another way. Let's look at the percentage of total jobs in the American workforce that are occupied by healthcare workers. This looks at an experience over the past 50 years. Back in the mid-50s, only about 3% of all workers were involved in healthcare. Look at what it is, at least until about 5 or 6 years ago. Almost 12%. Probably now it's up to 13 or 14% of all of the American workforce is involved in healthcare. When you look at these numbers in terms of professions within healthcare over the past 10 years, you can see that for all specialty areas, the color is green. There's growth across the spectrum of healthcare positions. At the top, you can see radiology technicians showing about a 25% growth, but there's not very many in that profession. So as a percentage, that still is fairly large numbers. Across the bottom, even more dramatically, you can see that over the past 10 years, there's been an increase of almost 600,000 jobs for nursing staff. We physicians are about in the middle. Over the past 10 years, about 10,000 or 100,000 more of us are needed, and about half of them are primary care physicians. You might ask, well, how are we supplying those numbers? Well, over the past 10 years, each of the medical schools has increased their graduating class substantially, and there truly is an explosion of the number of medical schools and osteopathic schools that have occurred in this country that really meet the demand that's required by the healthcare system. What are the numbers nationally going forward? Well, you can see from now until 2022, there's going to be an expansion of over 5 million healthcare jobs that are going to be created to meet the demand of healthcare in this country. I'm no math major, but I put this through my calculator this morning, and that's a 33% increase. Okay, why is this need increasing? Well, I can tell you, I'm part of the problem. Now, if I don't look in a mirror, I feel like I'm about 45 years old. I look in a mirror and probably what you see on this TV camera really expresses my true age of 65. Well, I've entered the problem age group. We have an aging population. Back in early 1900s, in terms of percentages, less than 5% of the American population was over the age of 65. Now, it's somewhere between 16 and 18% of the population, and by the year 2050, that population of people over 65 is going to be greater than 20% of the total American population. Here's the reality. Older people get sicker, they require greater use of the healthcare resources, which requires a greater need for the healthcare workforce. In fact, if you look at the numbers, the demand for healthcare services due to the increasing age of the population alone is estimated to be about 25% increase until the year 2025. So CFES, as you know, is interested in encouraging kids to go to school and trying to make sure that all the opportunities are given to them. What are the reasons for post-secondary education in the healthcare workforce? Now, some of your students may come up to you and say, you know, I don't need to go to college to be in the healthcare workforce. I can have a career in medicine that doesn't require that, and they're right. There's a huge need for bedside technicians. There's a huge need for home health aides and home health care providers. And indeed, they provide an incredible resource to our healthcare needs in this country. But the facts are that in the next 4 or 5 years, of all new jobs created, about 82% of them are going to require some form of college education, whether that be in a 2-year college or a 4-year college. And interestingly enough, about a quarter of all new healthcare workers are going to require some sort of graduate degree. How is that? Well, there's a lot of professions like occupational therapy, physical therapy, pharmacy that are now requiring a master's degree as part of their certification process. For nurses, about 80% of them are going to need some sort of college education, and about 50% are going to need a 4-year degree in order to get their RN and participate in hospital care. We as a country are not meeting the healthcare workforce requirement. About 22% of our healthcare workers now are brought in from foreign countries to meet that demand. Again, there'll always be jobs for students considering healthcare. There'll even be better jobs and higher paying jobs for those that embark upon a college education. Speaking of compensation, it turns out that professional workers, those with 4 years of college, are going to earn about 2.5 times more than the support staff. But even the support staff, in terms of comparable jobs with equivalent educational background and job responsibilities, are going to make about 10% more in healthcare than in other equivalent fields. When you look this charted out in terms of where compensations are in the healthcare workforce with respect to the average American income, you can see that almost all areas in those circles that represent the various sectors of healthcare are going to be earning more than the average wage. Down around the average wage are the bedside health care workers that don't require further education, but even compared to similar industrial positions in other sectors, they're going to earn a slightly higher salary. The jobs will always be there. The compensation is going to be more, certainly an incentive to encourage our students to consider this. The top healthcare jobs, actually, in terms of those within the healthcare fields, is assessed annually by the U.S. News and World Report. And what they look at is they look at years of education required, job satisfaction, work, home life balance, and compensation. They do surveys and they come up with the top 10 healthcare professions. And you can see that dentistry is the top, followed by nurse practitioner. My particular profession is not at the top, but certainly up there as a physician. It goes all the way down to number 10, occupational therapy assistant, which actually can be done with just a 2-year degree. They've redone this study recently, and it turns out that a physician assistant, here listed as number 7, is actually the most desirable job in the country today. So, why go into healthcare? We've already talked about jobs always being there. We've talked about compensation issues. We've talked about the requirement for advanced degrees. But I can tell you, this is the reason that I enjoy being in the job that I am. And it's all expressed in this picture here. Let me tell you about this patient. This is a gentleman that was involved in a car crash in upstate New York. His car hit a logging truck. Obviously, he lost that battle. At the scene, he had multiple injuries, with his chest being injured, his abdomen being injured, multiple orthopedic injuries, and actually he sustained a cardiac arrest. He bled to death at the scene. He was brought to a local hospital with CPR going. They resuscitated him and sent him to our trauma center. And in the first 30 days of being in our trauma center, he was in the intensive care unit for every single day. He went through 5 operations in the first 5 days and required major life-saving interventions in order to save his life initially and continue him through that critical care phase. After he was released from the hospital, he came back for 3 more reconstructive surgeries. And I can tell you the gratification in medicine was not getting this guy to be plucked from the throes of death. It was not getting this guy home. It was not even getting this guy feeling better. The gratification is in those little girls' eyes there, because we got her father back to her. That's what it means to be in medicine in terms of the attraction to a lot of people. In what other profession can you have a major positive impact on people's lives on a daily basis? Okay, I gotta wipe the tears from my eyes here. Let's go on to the next slide here. We don't do well in healthcare in all domains. One of them is diversity. We do a terrible job in diversity. We fail in diversity in healthcare. Here's a diagram showing a comparison of the diversity of several domains of healthcare workers compared to the population in terms of the composition of non-white providers. Non-white individuals in this country comprise 24% or 38% if you consider Hispanics. And in medicine, for a number of the different professional areas, we don't even break double digits. What can we do? Well, there's no clear good answer for this. We certainly should actively engage our hospitals, our practices, our medical groups to seek out a more diverse employment strategy. We have to have aggressive recruitment at the college and university level in order to improve the ratio of diversity in our students. And I think personally, we need to reconsider some of the prerequisites, at least going into medical school. What do I mean by this? Well, I've talked to a lot of students who are very highly qualified students and probably could do well in medical school, and they hit the wall, they hit their Waterloo with a particular course in their second or third year, and that's organic chemistry. Now, I'm not saying that we shouldn't be testing the students for their ability to succeed through the rigors of an educational program, because they're going to need to do that in medical school. But it's the course content that bothers me. I can tell you from my own perspective, I hardly ever use any of the principles that I learned from organic chemistry. And the course was incredibly difficult in that all I did was learn equations and get tested on the exceptions. In fact, much of what we learn in science in our undergraduate program can be assessed from a little iPhone in our pocket if we need to really grab onto that data in our clinical practice. That doesn't mean we shouldn't test our students in their college curriculum. I think it needs to be difficult, it needs to be rigorous, but maybe it needs to be in other areas of course content. I'm talking about some of the humanities. Turns out that medicine is scientifically based, but we're also putting an emphasis on communication, on empathy, on cultural awareness, and on professionalism. And our students can learn that in a number of different areas in college besides organic chemistry. Well, just a comment, not so sure that would go well with a lot of medical school admission committees. There's a lot of materials available on the internet, a lot of resources, such as this type of internet site, which really is directed towards minorities and their entry into healthcare. And certainly it is worth bringing to the attention of educators and students who are dealing with this particular issues. So what do we do to encourage our students to enter into healthcare? What can we do at the classroom? Well, first of all, is a recognition that about 22% of our students will enter healthcare because it's a family tradition. That's been shown in a number of different studies. If your father, your mother, some close relative is in healthcare, there's a likelihood that you're going to consider that very highly in your selection of professions that you may enter. I call that the Harry Chapin effect. I'm going to be a lot like you, Dad. Of course, that song didn't have a very good outcome at the end. But there is opportunities for the other 78%. And what we need to do if we want to pursue this is we've got to get the student to ask themselves the question, do I want to choose or even consider a healthcare career? Well, what can we do? Well, I call it the 3 E's of encouraging healthcare careers: excite, engage, and experience. We have to excite the student to kind of get interested in the first place, to have that epiphany that healthcare may be for him or her. We have to engage the student to further consider the healthcare domain, and then we have to provide some sort of experience. Let me elaborate on that just a little bit. Exciting. I call it the hook. Somehow we've got to hook these students into at least a momentary consideration this might be a field for me. I'm interested in movies, and the hook for Hollywood actually has to occur in the first 5 minutes. And for students, we have to do this probably fairly early on in their educational career to get them to continue to consider this profession or this area for career choice as we go forward. So how do we hook them? Well, we provide them some sort of excitement, some idea or exposure that healthcare is fun, it's exciting, it's rewarding, and you know what? We're pretty well off with that because every student who watches TV is going to be exposed to some sort of medical drama, medical comedy, some medical reality show, which is going to demonstrate to that student that A, this is exciting and fun, B, that it's rewarding, and C, maybe I can do this. Engagement is to take it to the next step, is basically through mentorship, taking that hook, taking that initial aha moment and maturing it into further exploration. We do that with mentors, and just to emphasize it, we do it with a lot of mentorship. So how can we get mentors into our classroom? Well, one thing is that every student probably has a mother or a father or a relative who's in the healthcare industry. And you can invite them to come in and talk about what they do, what is required to enter into that particular field, and encourage the students to further explore it. If you can't do that, call up a local doctor's office, call the medical society, call up a student organization in a medical school, because we in the healthcare professions like to talk about what we do. We'd love to come into your classroom and give the students our impressions of what it's like to be a healthcare provider. Finally, we need to give them some experience. That may be a little bit more difficult to do. If you have mentors that come in, perhaps they can bring a blood pressure cuff, show the students how to hands-on get involved in medicine or healthcare. There's other tools that we can bring into the classroom that are either computer-based or even hands-on based, like bringing in some casting material. Most hospitals have a med camp that they invite students to for summer sessions for a week or two each summer, and students can become involved in this, usually free of charge, in order to experience the healthcare professions with hands-on engagement. All of this can help cement a student's interest in pursuing these types of fields. So one of the things that we've done actually with CFES is we've tried to develop a video that really demonstrates what the healthcare profession is about and provides further information for the students to use in order to further their explorations. We did this, and primarily will be done initially down in Florida. We did this very simply in order to develop a tool that will be shown at CFES mentoring events. This video presentation really needs to be short, needs to show real people, not actors, has to incorporate our 3 E's of excite, engage, and experience. We made it very inexpensive by producing it ourselves. And at the end, we had a hands-on experience that will allow each of the students to really get their hands onto some medical technology so they can perhaps cement this idea of entering into a healthcare career more permanently. So the video presentation actually started off with a real medical situation. That was the hook. We had interviews with staff across many disciplines talking about the what, why, and how of their experience. And then at the end, we're going to give them the experience of taking a blood pressure, perhaps putting a couple sutures and some fake skin to let them know that, yeah, I can do this as part of their questioning of the appropriate field for them. So maybe I can show you just a few little vignettes from this video that we produced. It begins with a little scene of a cardiac arrest, which hopefully will encourage the student to become a little excited about about what we do. And I'm only going to show you about 15 seconds of each of these clips. Let's get the team in here. Minutes, is there a pulse there? Okay, let's get going. CPR, 100 per minute. Let's bang it. 10 per minute for the banging. Get the pads out, Jen. Next, we go on to a little vignette of me kind of introducing what we're going to be doing in this video clips. Basically going to be taking them on a tour of the hospital. Oh, hi, didn't know you were here. That was Mr. Tom Whitlock. He was enjoying a birthday party with his grandchildren when he began to have some shortness of breath and some chest pains. So I understand that the folks at CFES would like me to give you an introduction to the medical field as a possible career choice. Speaking of introductions, my name is... Then we take them on a tour of the hospital. We're going to introduce them to 8 different medical providers in the hospital. These short little vignette interviews will discuss the educational requirements for each of the specialty areas that we're talking about, what these particular people do on a day in and day out basis, and exactly what the attractions of those particular fields are to them. Sorry, it starts off with a little tour of me taking them through the hospital. Hi, Jenny.
Hi, Dr. Fortune.
How you doing?
Great. How are
Great to see you today.
Hey.
Hey, we're doing a video to encourage young kids to consider healthcare careers.
Yeah.
Can you tell us what you do here?
I'm a physical therapist here at the hospital.
And what does that mean?
Well, I go in and meet with patients and help them get moving. Maybe they've been hurt in an accident, and I go in and I help them get out of bed. I just help them feel better.
Pretty gratifying getting people moving
It's
after being in the
wonderful.
hospital for a while.
I love it.
Well, what got you interested in physical therapy?
Well,
And with each of these interviews, we'll have some blurbs in the corner, which will show what it requires to go into those fields and some of the compensation ranges. And finally, at the end, we're going to bring to the classroom some equipment that will allow the students to have some hands-on experience. This equipment will be a blood pressure cuff and a stethoscope. It'll be a little suture board. They'll put some suture into some artificial skin. And it's introduced with this particular vignette. Now for some fun. Just to show you what we do in a medical practice, we're going to teach you a couple of procedures that are quite common. The first is how to take a blood pressure, and the second is how surgeons sew up skin. Come on. So this goes on to give a step-by-step explanation of the procedures that are being done, again, to allow the student to do something in the classroom that really will get them interested in what we do and perhaps show them that this medical practice that we're involved in can be done by them. Well, thank you very much for your attention up to this point. I hope my comments have been helpful. I really appreciate CFES giving me the opportunity to speak to you today. And along with Aubrey, we're here to take any questions that you might have concerning this particular topic, which I find fascinating and certainly important to the future of the career that I've chosen.
Okay, Dr. Fortune, we do have a couple of questions. First, we have somebody who'd like to know how technology is affecting healthcare jobs.
You know, that's a very good question. And one might think that, like in other fields in manufacturing, technology actually would reduce the number of professionals and support staff that we need. It's just the opposite. As the technology gets more sophisticated, it requires actually more individuals to guide the technology appropriately in the diagnosis and treatment of our patients. So what we've done is we've actually expanded our treatment options. We've expanded our diagnostic options with the technology that we have into areas that we never really considered 10 or 15 years ago. And what this has done is actually create a lot more jobs that are necessary to both maintain and operate this technology that we're using. Many more options now in healthcare. That's resulted in many more jobs. Again, some of those positions for the students now in middle school and high school haven't even been developed yet. We don't know what medicine is going to look like in 10 or 20 years, but I anticipate there'll even be a greater need for people in healthcare. What technology has done is actually changed the distribution a little bit of our healthcare workforce. It's actually created a lot more options for those that have less than the highest level of professional education. My personal feelings, and don't tell this to my colleague physicians, is that a lot of what the physicians are doing nowadays is being supplanted by nurse clinicians and PAs, which is creating more of an opportunity at that level of the healthcare workforce, and probably less of a need in the future for physicians.
Great. We have a CFES scholar asking, do you have to go to a four-year college to work in healthcare?
Absolutely not. Many of the positions in healthcare can be learned, and you can receive training in two-year programs. And those positions are just as attractive and just as gratifying as those that take 12 years to learn. So a two-year college program will open the doors to a lot of healthcare opportunities for you in the future.
Another student would like to know, what are some good ways to include medical professionals in my curriculum?
That's a very difficult question. I hope I answered that for you. I can tell you, we like to talk about what we do in the healthcare professions. And it may seem perhaps awkward, or there may be some barriers in your own mind to calling physicians' offices or calling hospitals or calling medical schools to invite individuals to come in your classroom. But I think you'd be amazed at how easy that really is. I mean, we're all busy, but we all like to talk about what we do, and particularly encourage young people to follow in our footsteps. So oftentimes it's just a matter of getting into on the web for numbers or into the phone book to find where the healthcare providers are in your region and give them a call. I think you'll be surprised at how willing and affable they will be in coming to your classroom.
So if you didn't go into trauma, what other profession in the healthcare industry might you have looked into?
Well, first of all, why did I go into trauma surgery? And I'm going to kind of relate a little secret to you. I'm an adrenaline junkie, and trauma is probably one of the more exciting areas of medicine that is out there. And I think that's really what attracted it for me, what attracted me to that profession. Also, there's a lot of rapid gratification in trauma and surgery. We see our patients get well after performing a procedure or resuscitating them or putting them in the critical care unit. My second choice, believe it or not, would have been anesthesia. And I'm very interested in research. One of the problems I had in my career as a surgical researcher is that there was a lot of clinical commitments and a lot of a fair amount of inability to control my own schedule to get into the laboratory. So on many occasions, I thought that maybe anesthesia, which is more of a, I'm not going to say 8 to 5 job, but more of a controlled schedule job, would have been attractive for me.
Great. Well, thank you so much, Dr. Fortune. That's all the time we have, but there's been a lot of great information here today that I'm sure our educators and our scholars will put to good use. And I'd like to thank everyone who joined us today. A recording of today's chat will be available on the CFES website, so feel free to share with folks who are unable to attend today. The next CFES Live Chat will take place on March 29th at 2 p.m. with Rich Higgins, Associate Vice President for Enrollment Management at SUNY Plattsburgh. We hope to see you then. Thanks so much.